Since success means having a baby, it takes a lot of effort to achieve this. For this purpose, IVF treatment should not be considered to be a single-shot affair. Studies worldwide show that average pregnancy rate per cycle of IVF is about 30% to 40% for most patients. A chance of successful IVF treatment decreases with increasing age over 40 years or so. It also depends on the quality of IVF clinic, its services, and the superovulation regime used. If 3 good quality embryos are transferred, the chance of pregnancy is about 40% in that cycle. If more embryos are transferred, chances of multiple pregnancies increase. It is possible to maximize the chances of success of pregnancy, provided you observe certain restrictions. You should avoid all medications, smoking or alcohol, excess caffeinated beverages, change in dietary pattern, exercise, and hot tubs or saunas. Since IVF involves drug treatment, it involves certain risks and complications. Ovarian hyperstimulation syndrome is the major side effect known. There is lethargy and fatigue due to hormonal stimulation. Abdominal distension, discomfort, and dizziness may occur due to outpouring of estrogen-rich fluid into abdominal cavity. The chances of an ectopic pregnancy and multiple pregnancy also increase in an IVF cycle. There is a psychological risk of failure leading to anger, depression, and resentment. One possible outcome could also be the cancellation of the IVF cycle. One should not get discouraged if one IVF cycle fails. This is because even a failed IVF cycle gives valuable information about how your ovary responded, whether endometrium showed changes favorable for implantation of fertilized ovum, whether fertilization occurred. A failed cycle needs to be carefully analyzed so that the treatment plan can be modified for future cycles. After analyzing a failed cycle, it can be repeated after a month or so. This time gap would help to marshal the emotional strength of a patient. On such repeat occasions, there are many other techniques that can improve the ultimate outcome. Pre-implantation genetic diagnosis by embryo biopsy can be done to ensure that embryo are healthy and without any genetic disease. Co-culture of embryo with feeder cells would provide extra nourishment for better growth. Blastocyst transfer, wherein embryos are grown till blastocyst stage, a stage just before uterine implantation. This is then transferred to uterine cavity. Zygote intrafallopian transfer, wherein fertilized egg before cell division, that is, zygote, is transferred to fallopian tube during laparoscopy.